I often get asked by patients in clinic how much time they have with their diagnosis of mesothelioma, and I usually say that I cannot predict that for an individual patient, which is true, sitting in front of me, until I know how that patient responds to drug treatment, for example. However, generally speaking, I think it's useful to think of the rule of thirds when you're addressing survival in patients with mesothelioma. This has been shown by a number of studies. So approximately a third of patients with mesothelioma survive for about a year. A third of patients survive for between a year and 2 years. And a third of patients survive 2 years, and often in some patients several years going forward. It's important to remember that survivals are improving in a range of cancers and also in mesothelioma. So the most recent studies have shown incremental improvements at 4 and 5 years now, where we have data when patients start on new drug treatments. So we're clearly moving that bar constantly upwards. And I think going forward, the next decade, the next 2 decades, will certainly be lifting that 5-year survival even further for patients with mesothelioma, just as we've seen remarkable improvements in melanoma, where the survivals a decade or 2 decades ago were really very small at 5 years, and now about half of patients with melanoma are surviving at 5 years.